pediatric dentist. Went to New York University, did general practice residency at Woodhull Hospital. I did my pediatric specialty at Interfaith Medical Center, board certified, American Board of Pediatric Dentistry, and I'm director of dentistry at Ezra Medical Center in Borough Park and private practice in Flatbush, Midwood.
So I heard a fascinating story that you helped hundreds of patients during and throughout the peak of COVID-19. So tell me a little bit about that.
Among the things that people were talking about are the heroes of COVID and the healthcare providers that were heroes. And I think unbeknownst to people is that the highest rate of exposure, the highest risk of exposure is to the dentist because we are in their mouths. We're wearing masks because we have to prevent exposure. And the dentists are going in their mouths and creating aerosols. And so we are far and away the highest risk group, dentists and dental hygienists. And the state stopped us from treating regular patients somewhere around mid-March. But we were allowed to continue treating emergency and urgent care patients. And many dentists just closed up shop and left a lot of patients without where to go, either because they weren't allowed to open, they were afraid to open, they were physically unable to open, they didn't have staff, they were themselves sick. For whatever the reason is, there were hundreds of patients that were left without care, hundreds of patients that were in pain. And at Ezra Medical Center, we tried to come up with something that was safe for the providers, safe for the staff, and safe for the patients to continue treating at least the emergencies. So there was some sort of coverage in our area for people in dental emergencies.
So tell me a little bit about that procedure. Like, what did you implement to keep everyone safe?
Well, we followed with CDC guidelines. We followed American Dental Association guidelines. We listened closely as to what we can and can't do, and the guidance was somewhat vague, honestly, but we did the best that we could in the situation that we had. Many of the hospital programs were doing minimal treatment at best. There were some private practices that were open, and all of these doctors, these dentists, put themselves at tremendous personal risk. What we did at Ezra was we followed the guidelines, the CDC guidelines, and we used PPE, protective equipment, and we used masks, N95 masks, and we just reiterated: choose the emergencies that are important, that are relevant, and in terms of people that are really in pain, don't turn people away. If they may be COVID or not COVID, assume that everybody's COVID. The ADA had a recommendation to do peroxide rinse. There's no proof to say that it helps or that it doesn't help, but it doesn't hurt. So we did everything we can to reduce aerosol emission and to protect the doctors. And fortunately, over the course of the peak of the COVID experience, we saw several hundred patients. I don't want to discuss the numbers because I can't discuss it publicly, but we saw several hundred patients. We also did teledentistry, and the patients that were real emergencies were seen, and we treated them to the best of our capacity. And the patients that were either not emergent or if they, for example, they needed extractions, so they referred to one of the few oral surgeons that were open, one of the few endodontists to do root canals. And all of these doctors really put their lives at risk. And I think that they're not recognized for the heroism that they really exhibited, and the care, the heart that they have, that they really are, practitioners that just gave. They gave without thinking of their personal. They were thinking of their personal care, but they gave of themselves,
right.
And they really ran the risk of really getting sick. And thankfully,
Now, how many team of doctors were you?
So what we did was we had to let some of the doctors go, so we divided up into two teams. So we had a pediatric dentist and a general dentist, two teams of one pediatric dentist, one general dentist. They rotated over the course of 5 days, so we had 3 days and 2 days. Then the next team did the 3 days and the 2 days. In terms of one team would never be together with another team. So if one team, somebody got sick or somebody was exposed, that second team would always be available. So we never had an overlap of the teams. And like I said, we followed the rules. We used the PPE. We used the masks. We were careful with what we were exposing. For example, we do an extraction. We did it under suction, and we did it under something called a rubber dam to protect the doctor and protect the patients.
And that's something that would normally, before COVID-19, not really be used
you would
that
use
much.
it, but we wouldn't use it in the context that we were using it in.
Meaning,
In other
like
words, we
every single
expanded-
patient expanding.
We expanded the use as much as we can to protect the doctors and to protect the patients. We had one
Right.
patient that was, the mother was sick with COVID, and it was, I think, a 9-year-old boy, and had an abscess. And we went back and looked at the X-rays, and we saw he needed to be treated.
Because that's dangerous if it's not treated,
he
right?
was
It goes
swollen.
into the bloodstream.
His face was swollen.
Wow.
So it needed to be done. And I told the pediatric dentist that was on call that day, I said, look, I understand your call. Put him on antibiotics or extract. And he looked at me and he said, the child's in pain. Take out the tooth. So we called him in and we extracted the tooth. And the kid's okay. And the important thing to note is that all the doctors that were treating at that time and the staff members, by simply following the rules and using the PPE and the masks and having the caution that they used, even though they saw literally hundreds of patients, it seems that none of the doctors are positive for any exposure. They have neither
That's incredible.
PCE.
And I would assume the patients also using mouthwash to come in, because it's a dentist office.
Well,
and
again,
stuff
we
like
followed what the ADA was recommending, which was to use peroxide rinse. There's no evidence to show whether or not it helped or not, but that was the recommendation, rinse before, and we did it.
Is there anything stronger than that though? Like
So
that,
the whole
that
point is
someone
there's
could
something-
use
there's-
if someone wants
So
to do
there
it in
was,
their
for
house.
example, the I don't want to say which one, but there was one of the associations recommended use of something called chlorhexidine, which is a common oral rinse, but they didn't realize it's a great oral rinse against bacteria. It has no effect on viruses. So to use chlorhexidine rinse prior to treating a patient that has potential COVID was
Right,
essentially
right.
useless, and
Makes
that
no sense.
recommendation was not really a good recommendation.
Right. Is Listerine, by the way, in general good? In the house they say use Listerine. Is
Listerine
that a
is
good?
bacteriostatic, so it is something that stops the growth of bacteria, and it is a great bacteriostatic rinse. And yeah,
So what would you recommend, like for personal use? Someone in the house is going to be watching
Again,
this.
it
In general,
depends-
for good
it
hygiene.
depends,
What?
it depends. Good hygiene includes the brushing and the flossing, and
Right.
For the kids, I ask to use fluoride rinse. I think that's a great adjunct. Obviously, the flossing is important, but a lot of kids will not do that. And a lot of adults won't do that. But I think fluoride rinse for children is fantastic because it gets in between the teeth and helps prevent the cavities that develop in between the teeth. So there's a lot of good products out there. We have to be more about using them with regularity, brushing with regularity.
Right. You probably see in your practice, you could tell who brushes right way and who doesn't, right? You could tell probably
We
looking.
can say who brushes and who doesn't. We can also see, for example, things like who has reflux. So you can look in somebody's mouth and see if they have gastroesophageal reflux just by looking at their teeth and seeing the erosion patterns on their enamel. So
Wow.
sometimes it's not about just eating candy. It's about, they actually have a problem with gastroesophageal reflux, and the acid that comes up is causing the erosion of their teeth.
Wow.
So
So thank you to Ezra Medical Center and to all the dentists out there that really gave up themselves.
they really did. Thank you.
And if somebody needs to reach you, how do they, if they want to make an appointment, just call Ezra Medical Center?
Well, I don't see patients at Ezra Medical Center, but we are seeing emergencies now for. Usually we see only our patients at Ezra because we are fully booked. But right now we've extended to see any patient of any practice who doesn't have a doctor available to them. So if you have a doctor, if your provider is available, obviously we ask that you go to provider. But if your provider is not available and you don't have a way to get emergency care, we are open for anybody who needs it. The number there is 718-686-7600.